Welcome, everyone, and thank you for joining today. My name is Kira Odudu, and I am excited to be presenting Seed and Sanctuary today. This presentation will be addressing today's objectives, which are the current state of infant mortality in Baltimore City, our organization's approach to these statistics, and also opportunities for collaboration. Now, let's discuss the problem. Baltimore faces an infant mortality rate of 8.3 per 1,000 live births, compared to the national average, which is a rate of 5.5. Alarmingly, Black infants are 3 times more likely to die before their first birthday. Despite the new programs, over the past 5 years, Maryland's overall rate of infant mortality has been pretty steady, with the average Maryland infancy mortality rate of 6, yet Maryland Black babies have an average of 8.3 over the last 5 years. At Seed Sanctuary, we want to focus on high risk pregnant women and new mothers in underserved Baltimore neighborhoods. Over 60% of Baltimore residents identify as Black or African American, and 1 in 5 residents live below the poverty line. Here, I circled a couple of the locations that serve as high risk areas for infant mortality. In these neighborhoods, many individuals have challenges that affect their health, such as transportation needs, food insecurity, and just not having the resources to get to these appointments that they need to attend. Infant mortality is an important measure of maternal and child health, and some of the causes include low birth weight, sudden infant death syndrome, congenital abnormalities, and maternal complications. Our data sources include the CDC and Maryland Vital Statistics, which help us to monitor the trends and target interventions very effectively. Seed and Sanctuary's mission is to reduce preventable infant deaths through equitable community based services. We provide culturally tailored education, holistic care, and foster strong community partnerships to address both medical and. Well, some of the goals of the program include reducing unsafe sleep deaths and maternal complications, improving birth outcomes by tackling prematurity, and expanding access to prenatal and postpartum care. Well, what does that look like? Here we have identified some of our objectives for 2026, 2027, and 2028 that involve educating and pretty much serving our community. Our program is guided by pre-seed, pro-seed model, which structures needs assessments, intervention design, and evaluation. We also look to social cognitive theory, um, which you'll see our approach in our peer learning and self-efficiency, and pretty much creating a supportive environment for our families. Here are some of our intervention, which includes a safe sleep incentive program, using one of our apps to track how mothers are putting their babies down to sleep. And it has a lot of perks to that as well. We have Mama's Table and Abuela's Pantry nutrition sessions. We do give out food and help moms make better nutritious choices. The Village Support and Wellness Passport is pretty much a program where we track whether the mom is actually attending her prenatals and postnatal checkups. We also like to support moms in home when we can. Un Momento is more of a stress relief and healing space for the moms. To kick everything off, we would like to start with a community event such as a community baby shower and cookout for outreach purposes, enrollment, and also as a fun event where parents would get free supplies, food, music. It's just an overall fun event. To make all of this happen, we do need some resources, supplies, staff, and partnerships. Benefits includes maternal knowledge, greater access to affordable care, and improved infant survival in the early years of life. For the community, lower infant mortality rates, stronger trust and collaboration between community partners, and more engaged and resilient families. Um, for our stakeholder involvement, we plan to fund cradle kits, food boxes, event costs, host events and workshops. We plan to advocate for Medicaid coverage, which includes the services we need for our mothers and sharing the program outreach with others. We plan to use social media campaigns like Safe Sleep Challenge and by engaging with our community for referrals or to give referrals to those who need them. And this includes my presentation. Here are a couple references that I used to complete this presentation.